Every year, millions walk into operating rooms believing surgery is the only path left, only to realize the risks weren't fully explained. Sometimes the surgery itself becomes the beginning of a much bigger problem. People often rush in without knowing the full reality of recovery. One major medical review shocked doctors. It found several common procedures are performed far more often than necessary. Even when safer non-surgical options produced nearly identical outcomes, thousands still went through unnecessary pain and complications. And here's the part nobody likes to say. Fear sells urgency. Urgency fills operating schedules. The more afraid you are, the faster you agree. Today, we're talking about the Surgeries research is forcing doctors to rethink. Some are helpful, but others are recommended to people who may never have needed them. The final surgery on this list leaves patients saying the same thing. If I had known this before, I would have slowed down. Before we start, comment below. Has a doctor ever told you surgery is your only option? Your experience might help someone else. Let's begin with one of the most common surgeries today, spinal fusion. Back pain is terrifying when it starts controlling your life. Technically, it makes sense. Joining sections of the spine together to stop movement should stop the pain, at least in theory. But long-term studies found many patients who had fusion reported pain levels similar to those who chose structured physical therapy. Fusion is not a small operation. Recovery takes months, and once fused, surrounding areas often absorb extra stress, leading to more issues. One patient described it perfectly. I thought I was fixing one problem, but I ended up trading it for 3 new ones. In severe cases, it changes lives. But many never hear about the evidence for conservative treatments first: PT, core strengthening, and mobility training. Now, let's talk about a surgery surrounded by fear the moment you hear the diagnosis: prostate surgery. The word cancer changes everything. Many feel pressured to act immediately, but some prostate cancers grow so slowly that they may never become life-threatening. Large studies show that for low-risk patients, active surveillance often produced survival outcomes very similar to surgery. The side effects can be devastating: urinary leakage and life-altering changes that nobody fully explained before the procedure. Sometimes the smartest medical decision is not acting aggressively immediately. Careful monitoring is often the more intelligent strategy. Modern culture teaches us that doing something feels safer than waiting. But medicine doesn't work on emotions, it works on evidence. Finally, let's look at a surgery that was completely transformed by technology: severe aortic valve disease. For decades, this meant open-heart surgery, a massive incision and weeks of painful recovery. But technology changed the game. The lesson: always ask questions, seek a second opinion, and remember, faster isn't always better. Your health deserves the evidence. Then, newer, minimally invasive procedures started changing everything. Doctors discovered they could replace valves using a catheter inserted through an artery. Instead of opening the chest completely, it's a much smaller procedure with shorter recovery. The results forced many hospitals to rethink their entire approach. For properly selected patients, minimally invasive valve replacement often produced recovery advantages that were impossible to ignore. Patients spent less time hospitalized. But here's what many don't realize: not every hospital offers the same advanced options. Recommendations can differ depending on where you go. That's why second opinions are powerful. Not disrespectful, powerful. Medicine evolves, and sometimes standard advice depends more on local habits. Now here's one that surprises almost everybody: hernia surgery. Most assume every hernia needs immediate repair, but that's not always true. Some hernias remain stable for years. For certain patients, careful monitoring may actually be safer than rushing into an operating room. The important detail is symptoms. If it becomes painful, trapped, or suddenly enlarges, that changes everything. Emergency situations are different, but many hernias don't become dangerous overnight, while surgery carries real risks: nerve pain, infections, and long recovery periods that interrupt your life. One study found patients living with minimally symptomatic hernias reported similar quality of life outcomes compared to those who chose immediate surgery. And honestly, this next surgery might be the most misunderstood one of all: knee replacement surgery. Advertisements make it sound almost magical. New knees, new life. But real recovery is often far harder than people expect. Some improve, but others struggle with stiffness and persistent pain. Researchers noticed something. Patients who entered surgery physically weak had worse outcomes. This created a new approach called prehabilitation. Instead of rushing, patients spend months strengthening muscles and losing weight first. Some improve enough that they delay surgery far longer than expected. One specialist explained it perfectly. The stronger the body enters surgery, the better the body survives surgery. Simple idea, huge difference. Finally, let's talk about a surgery many regret because they expected a quick fix for digestive problems. Gallbladder removal. It's one of the most common procedures worldwide. For severe stones or infection, it can absolutely be necessary. But not every symptom is a gallbladder issue. Some undergo surgery expecting complete relief, only to continue having bloating, stomach discomfort, or food intolerance afterward. Why? Because if the gallbladder wasn't the primary source of the problem, removing it won't fix the symptoms. Diagnosis must be precise before action is taken. The path to health isn't always through an operating room. Be informed, be patient, and always advocate for your own recovery. See you in the next part. Because digestion is incredibly complex, and sometimes the gallbladder was never the real source of the symptoms in the first place. That's why careful diagnosis matters so much before surgery. The body rarely gives simple answers. Now, here's the part most never hear before agreeing to elective procedures. Surgery creates stress the moment recovery begins. Muscle loss, sleep disruption, blood clots, and emotional exhaustion. Even successful surgeries place enormous strain on the body. That's why truly great doctors don't just ask, "Can we operate?" They ask something more important: should we operate? Big difference. Here's something else rarely discussed. Many patients confuse confidence with accuracy. A doctor speaking confidently doesn't mean every recommendation is correct. Medicine contains uncertainty everywhere. That's normal. The best physicians explain both benefits and limitations honestly. They discuss alternatives and risks. If someone rushes you aggressively toward surgery without discussing conservative options carefully, pause. That pause could protect you. If this is helping you think differently, hit the like button and share this with someone who trusts doctors blindly because they feel scared. Informing others saves regret. Now let's continue with another surgery many assume is harmless because it's considered routine. Back injections leading to repeated procedures. Sometimes patients start with steroid injections, then another and another, until surgery becomes the next step because temporary fixes stopped working. But repeated interventions can create dependency instead of addressing the underlying causes: weak muscles, poor movement patterns, and loss of stability. Pain is complicated. Chasing short-term relief often delays long-term improvement. Movement is medicine, when prescribed correctly. That sentence changed how many approach chronic pain. Now let's talk about a fast-growing concern in modern healthcare: overdiagnosis. Technology became incredibly powerful. Scans now detect tiny abnormalities constantly: small disc bulges, minor tears, early degeneration. We can see things we never saw before. But just because an abnormality exists on a scan doesn't mean it's the cause of your pain. Treating the scan instead of the patient is a major driver of unnecessary surgery. We must look at the person, not just the picture. True healing starts with a relationship, not just a procedure. In Part 4, we will look at how to have these difficult conversations with your medical team. Your health is your most valuable asset. Protect it with evidence-based decisions. Stay informed, stay active, and I'll see you soon. Thank you for watching. Don't forget to subscribe and join our community of informed patients. See you in the next part. But repeated interventions can slowly create dependency on procedures instead of addressing the underlying causes directly. Weak muscles and poor movement. Pain is complicated. Chasing short-term relief often delays long-term improvement. Movement is medicine, when prescribed correctly. Now, let's talk about a fast-growing concern in modern healthcare: overdiagnosis. Technology became incredibly powerful, but there's a shocking part. Scans detect tiny abnormalities constantly: bulges, tears, and degeneration. But many people with no symptoms also show these same findings. Not every abnormal image explains the pain. People see scary results and believe surgery is necessary, but imaging should support symptoms, not replace thought. One radiologist admitted, "If we scanned enough healthy people, we'd find abnormalities almost everywhere." That perspective matters more than you realize. Imagine this. A patient feels pain, gets an MRI, sees degeneration, and becomes terrified. They stop moving, muscles weaken, and the pain increases. Fear itself becomes part of the problem, changing medical decisions dramatically. That's why education and information are so powerful. Informed patients ask better questions. What happens if I wait? What are the alternatives? How many times have you personally done this? Those questions matter. A lot. And now we reach the final surgery on our list, one that continues exploding in popularity despite growing concerns: elective spinal disc replacement and aggressive multi-level procedures. Modern spinal technology looks impressive, but technology doesn't guarantee outcomes. Some improve dramatically. Others experience years of repeat operations, scar tissue, and chronic pain cycles that become difficult to escape. One specialist said, "The hardest patients to treat are often the ones who already had multiple surgeries." That sentence says everything. Each additional surgery becomes more complicated than the last. More scar tissue, more instability, and more recovery challenges. This is exactly why slowing down matters before elective operations. Not avoiding surgery forever, but slowing down long enough to understand all the options. Because informed patients make better decisions, and better decisions protect your future. Remember, surgery is not simply the fastest option. The goal is not avoiding surgery at all costs. Some save lives and restore mobility. The goal is making sure it's truly the best option for you. Ask harder questions, request second opinions, research recovery realities honestly, and never let fear make decisions for you. If this changed your perspective, comment "taking my time" below and share this with someone who believes surgery fixes everything forever. Subscribe for more evidence-based health discussions. The next video might change how you view medications, hospitals, and your long-term health. Take care of yourself. Ask questions, stay informed. The smartest patients understand their options completely before making life-changing decisions. Not medical advice. Always consult a qualified healthcare professional regarding your personal medical decisions. Thank you for watching the series.